Hi, you guys. Welcome back for our daily practice questions. It is day 116. And as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 26-year-old man presents with a painless ulcer that developed 2 weeks ago. He denies dysuria or discharge. On exam, you find a clean based, firm, non tender ulcer that is noted to be a chancre. What stage of syphilis does this presentation most likely represent? Is it A, primary syphilis, B, secondary syphilis, C, latent syphilis, or D, tertiary syphilis? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what stage of syphilis does this presentation most likely represent? And so a few things, you should start to think of the stages of syphilis and the presentation and what that looks like. But here, this person has a chancre. Chancre sores are classified in A, primary syphilis, okay? All right, question number two. A patient presents with symptoms suggestive of secondary syphilis. Which of the following is the most appropriate initial diagnostic test? Is it A, dark field microscopy or ulcer sample, B, RPR testing, C, FTA testing, or D, skin biopsy of a rash? Take a moment and tell me what you got, y'all. All right, so stem of the question here states, which of the following is the most appropriate initial diagnostic test? All right, what are we trying to diagnose? So we're thinking syphilis, secondary syphilis. So with this, RPR testing is the best, so B is your best answer here. And then lastly, question number three, a 30-year-old woman is diagnosed with early syphilis. She has no known medication allergies. What is the first line treatment? Is it A, doxycycline, 100 milligrams orally twice daily for 14 days? Is it B, azithromycin, 2 grams orally single dose? Is it C, penicillin G, 2.4 million units IM in a single dose? Or is it D, ceftriaxone, 250 milligrams IM with a single dose? Take a moment and tell me what you got, y'all. All right, so stem of the question here is, what is the first line treatment? Y'all know what I always say. When they're looking for a treatment, you need to run it back and see if they provided you with a diagnosis. And in the event that they have not, you got to run it back a step further and look at those assessment findings so you can determine a diagnosis, because you got to know what it is to be able to treat it, right? So here, the diagnosis is provided. We are in the early stages of syphilis. So what is your first line therapy? Your best answer is C, penicillin G with an IM single dose is your first line therapy for syphilis, okay? All right, you guys, I hope you found this helpful. As always, please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number one, at gmail.com. Everything that I offer is linked in the bio of this channel. And if you're looking to book any of my one-on-one sessions, any of my custom packages or plans, or any of my question analysis sessions, as always, I tell you to call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.